So I just want to briefly talk about common ankle injuries. The previous doctors mentioned certain things that they have seen. And now that we're in October, November, we're seeing practically every sport at every level. It's baseball, football, basketball, soccer, dancing, cross country, ice hockey. So we're seeing a lot of people. And I want to talk about some basic definitions because I think there's a disconnect when people have an injury and they go to the emergency room. And I want to explain what a sprain is. A sprain is when you damage ligaments. Ligaments are ropes that keep our skeleton together, and they only have so much ability to stretch out. And when there's a violent force applied to the ligaments can start stretching out or tearing. So if someone just tells you that, hey, it's just a sprain and you'll be fine, you definitely want to have a specialist look at you because sprains can lead to severe arthritis down the road. A strain is when you damage muscles or tendons. That means you stretch those out. Those are generally structures that have a little bit more flexibility. Muscles have better blood supply, so they can generally heal a little bit quicker. And tendons have a little bit more collagen impact, so that there's more stretchability, elasticity, so that they allow like a rubber band for the body to move. Sometimes people come from the ER and they say, hey, they told me I have a fracture, and you tell them you have a broken bone. It's the same definition, and we'll discuss that briefly. And lastly, if you ever hear or see some athletes or yourself, if someone has an injury, you can dislocate a joint. And that basically means a joint is popping out of the socket. So the ankle is one of the most common areas where ankle sprains are damaged, and ankle sprains are one of the most common areas that we can start tearing ligaments. And this slide basically shows you on the outside of the ankle, there are about 3 ligaments that really hold the ankle from going inward. If someone falls, if someone is unexpected, ligaments can only resist so much pressure before they tear. Over time, those ligaments can tear and even pull bone apart and causing for some really bad injuries. So please appreciate that ligaments, once they're damaged, it can cause for problems down the road, such as instability, can't go in heels, sometimes walking down steps of stairs. A lot of people who have bad ankle injuries that are neglected will lose balance issues and can't stand on one leg. So if you notice an injury, it's important that if you go to the ER, follow up with a specialist. An ankle injury will usually present like this picture. You're going to have significant pain. You're going to eventually get bruising, and that bruising will get worse over time. So usually around 3 to 7 days after an original ankle injury, you'll start noticing more pain and swelling. You'll get guarding. You'll start losing motion of that ankle. And even in some situations with a bad ankle sprain, you can damage the nerves. The nerves can get stretched out, and it can persist with a little bit numbness and tingling. When somebody comes in with an ankle sprain, we always should take an x-ray because it's not always the bones that are injured. The ligaments can be damaged. The doctor should be able to evaluate the ankle and do some testing to see what the integrity or what the strength of the ligaments are and how flexible they are or how guarded you are. And if the ankle x-rays do not show any significant damage, it's going back to seeing how much bruising and swelling there is. People who have increased pain, increased swelling, shows us the severity of the ankle ligament is going to be damaged. There are 3 degrees of ankle sprains. First degree, which you stretch them out. Most people will get back to activities with a brace within 2 to 3 weeks. The second degree is where the ligaments are partially torn, and that can take anywhere from 6 to 3 months to get back to some type of good activity if you're an athlete. And then if you completely tear a ligament, that's a 3rd degree injury. And you can tear it completely in the mid-substance of the ligament, or you can pull it off the bone. Sometimes we do advanced imaging like this MRI, and it can tell us if the ligaments are torn, if the bones are bruised, and also tell us if there's swelling throughout the joint and look at the tendons. So MRIs are very helpful in determining if somebody may need long-term immobilization, physical therapy, or surgical intervention. Stress films. A lot of times people will guard. You can't really do this when they're awake. So if I take someone to surgery, even if the MRI shows normal ligaments and someone is struggling and they have balance problems and they have continued issues, a stress film will tell us the integrity of the ligaments, and that will tell the surgeon what needs to be done from a surgical perspective. Treatment options for ankle sprains: immobilization, physical therapy, bracing, regenerative medicine, and surgical intervention. Not everybody needs surgery and not everybody needs casting. And you have to really look at what sport the athlete is doing, how active they are, how old they are. And as mentioned earlier in today's series of lectures, children are treated definitely in a different light than adults because they have growth plates and bones are developing, and you don't want to damage them down the road. Another injury we'll talk about, they were talking briefly about patella tendon. The patella tendon and Achilles tendon are pretty similar in their construct. They are very large, strong tendons. They don't have the greatest blood supply. And when you injure a tendon, that is called a strain. You can stretch it out, you can partially tear them, or you can completely tear the tendon. In some situations, I wish people would completely tear their tendon because when they have a partial tear, they neglect the Achilles, and over time, the Achilles tendon will start to lay down scar tissue. And the more scar tissue that the tendon develops, you'll start noticing a bump or a bulbous-like swollen part of your Achilles, and you'll start losing strength. You'll start having pain. And then if you look at someone on an MRI, they're going to have chronic scar tissue. So the mobility, strength, and flexibility of the Achilles is diminished. And that could be more painful than an acute injury over time. So if you're having pain or discomfort and someone tells you that you hurt your Achilles, the treatment will be very similar to ankle injuries, but I definitely recommend having immediate evaluation by a medical specialist so that they know what the proper treatment is to prevent long-term problems. This is an MRI, and you can see the gap where the black structure is. An Achilles tendon should be continuous. If someone has a complete rupture, then unfortunately, that person will need surgical intervention, and there are many ways that you can repair an Achilles. Treatment is immobilization for partial tears and strains. Try to catch them early. Aggressive physical therapy, regenerative medicine, and then there's surgical intervention. Acute injuries, such as an acute tendon tear, Achilles tendon tear, typically will need surgery if the person is athletic. If it's a partial treatment, there have been some new minimally invasive techniques that can help with chronic scar tissue in the Achilles tendon, combined with regenerative medicine, and a lot of times people can avoid a major reconstructive surgery. When someone tells you that you have a fracture, that means the bone is broken. But what you have to understand that when we see people with ankle injuries, it's not necessarily the bone that will be the limiting factor in how well somebody does. It's the ligaments that are damaged. If I look at this x-ray right here, we can say that, okay, 2 bones are broken, but in order for that x-ray to sustain that type of appearance, we know that there's a physical attribute and mechanical inclination for that type of fracture to develop. And ligaments have failed and have torn, and this ankle is very unstable. And if this ankle heals in this position, this person will unfortunately wind up with the ability of not walking or may need an ankle fusion. And in some situations, if the ankle's in good alignment, down the road, if arthritis is very bad, they may need an ankle joint replacement. So ankle fractures are not just with broken bones, but to sustain a broken bone, there could be soft tissue involvement. And yet again, see a specialist for that. And we talked about ankle fracture treatment. You can see this is a pretty bad fracture, needs a lot of hardware, needs a lot of fixation. And even though this may look good as a repair, most people with these type of high velocity injuries and this pattern of injuries do not do well long term. And this patient may need special bracing. They may have stiffness in their ankle. They may need more surgery. And ultimately, they may need an ankle joint replacement, ankle joint fusion. And if this person has some issues, and if they have complications, an amputation is even a possibility from these horrible injuries. And last but not least, ankle dislocation means that the joint pops out of the socket. And if that joint pops out of the socket, that is immediate surgical intervention, or you have to reduce that fracture. Otherwise, a person can lose sensation, the blood supply can be compromised, and you can start losing blood flow to the tissue, and that is not a good thing. So if an ankle dislocation comes to the ER, hopefully the emergency room people can relocate it under some sedation, pop it back into place so the blood flow and nerves won't be damaged long term. Dislocation treatment needs immediate attention, and the reason being is that the blood vessels in the nerves can be compromised, And if they're compromised too long, person can lose their foot and ankle or an extremity if something like that happens to the upper extremity. So in summary, these terms are very important to understand. Once again, quickly review, ligaments are the ropes that keep our skeleton together, and they only have so much ability to stretch, and if the forces are too great, they're going to tear. And depending on how badly these ligaments are torn, at what degree, first, second, or third degree, will indicate how long somebody will need before they're out of competition, if they can go back to work, if they can do normal activities. Seeing a specialist is very important for that. Number two is that when you strain muscles and tendons, generally those recoveries can be a little bit quicker because of the formation of collagen and blood supply, but also needs medical treatment. A fracture equals a broken bone, and a dislocation is when something pops out of the socket. Seek professional and expert care immediately for those conditions, especially if you go to the ER. Proper and early detection and treatment can reduce complications, and do not self-diagnose and treat. And lastly, try to avoid Dr. Google if there is a medical emergency or an injury that requires emergency room treatment.